I am Dr. Chandroth, working as internal medicine specialist in Jeddah National Hospital, Jeddah, Saudi Arabia. Today I am going to speak about hypertension. May 17th is conducted by WHO as World Hypertension Day to create awareness about hypertension or high blood pressure. Hypertension or elevated blood pressure is a serious medical condition which can affect our heart, brain, kidney, eyes and other organs. An estimated 1.2 billion people are affected by hypertension worldwide. An estimated 46% of adults are unaware that they have this medical condition. Less than half of the adults, that is 42%, only are being treated for hypertension. Only 20% are their hypertension under control. And hypertension is a major cause for premature death worldwide. Actually, what is blood pressure? Blood pressure is the pressure exerted in the blood vessels of our body. Blood pressure is diagnosed by a simple measurement of your blood pressure with a machine called sphygmomanometer, which can be conducted by a doctor, a nurse, a paramedic or whoever who is trained in this. Excessive salt consumption, a diet high in trans fat and saturated fats, reduced physical activity, obesity, taking low amount of fruits and vegetables are risk factors for developing hypertension. Consumption of tobacco or alcohols also increase the risk for high blood pressure. The risk of hypertension increases when your close relatives have this condition or you have diabetes or kidney disease. The common symptoms of high blood pressure, usually they are symptomless. Hypertension is called a silent killer. Most of the time it won't present with a symptom. When the blood pressure is really high, too much high, they can cause some headache, giddiness, irritability or shortness of breath. So the only way to diagnose hypertension is to get checked your blood pressure by a doctor, a nurse or a paramedic. The complications due to high blood pressure or hypertension are many. It can cause heart failure, that means the pumping of blood by the heart will be affected, which can lead to heart failure. It can cause heart attack or it can cause abnormal rhythms of the heart. When it affects the brain, it can cause stroke. 87% of the stroke are mainly caused by high blood pressure. High blood pressure can complicate your kidney and it can cause permanent kidney damage. Hypertension can affect the blood vessels of the eyes and it can cause retinal damage. So when we control high blood pressure, you can avoid or delay the incidence of heart attacks, heart failure, then stroke, kidney damage, etc. The blood pressure burden can be reduced. Is there any way to prevent hypertension? Yes. Because it is a lifestyle disease, you can reduce the risk of getting hypertension by reducing salt consumption, by limiting the intake of high saturated fatty foods, by reducing trans fat in diet, avoiding use of tobacco or alcohol, being physically active most of the week, by reducing stress, regularly checking blood pressure and treating high blood pressure if not controlled by these measures with medicines, and also to managing other medical conditions like diabetes or cholesterol.